This coming Thursday, October 10th, is World Mental Health Day. And the theme for this year, Mental Health at Work. I want to welcome Dr. Hazel Othello, who's the Director of Mental Health at the Ministry of Health this morning, to chat with us a little bit about mental health at work. Good morning to you, Doc.
Good morning.
How are you doing this morning?
I'm fine, thank you.
Thank you so much for waking up early this morning and joining us on set. We appreciate it. Tell me a little bit about the theme for this year, Mental Health at Work. What is the focus of it?
Okay, the full expression of that theme is it's time to prioritize mental health in the workplace. And, you know, the World Federation of Mental Health, who determined through a voting process, the theme for each observance of World Mental Health Day, the consensus this year was that we really needed to focus on mental health in the workplace. You know, for the average adult, most of your waking hours, are spent in the workplace. Yeah. It's the single place that you spend most of your time, other than in bed. And we take workplace mental health for granted. We just assume that people are okay. We assume that if they're productive, that means all is well. And sometimes people are battling against all kinds of challenges and showing up for work every day, acting as though everything is normal, but they're struggling. And, you know, as a society, we have to understand that if we're going to spend most of our time in the workplace, we have to prioritize our workplace mental health. We have to create the kind of work environment that is not just geared towards maximum productivity in terms of the financial output or the goals of the organization, but also maintaining the mental health and physical health of our workers, because they're intertwined. If your physical health is not in a good place, it affects your mental health, and vice versa.
Now, here's the challenge, right? As a business person, as a business owner, as the case may be, how do I then say, all right, I want to prioritize mental health, but I know it's going to come at a cost. What value do we place on mental health?
Well, the actual reality is that if people aren't healthy, they can't be as productive as they would normally be. The World Health Organization has estimated that the annual cost of lost productivity due to mental health challenges, depression, anxiety, and other things, is in the order of $1 trillion a year, right? So if we're talking about our financial output, we don't, as an individual organization, know how much we're losing to poor mental health. Because who quantifies that at the organizational level? But we are. If we're not prioritizing it, we're losing, and we don't even know how much we're losing.
What does that mental health support look like at the workplace?
At the workplace, it covers a lot of issues. It covers the way we interact with each other, with co-workers, with subordinates, with supervisors, you know, creating that environment where even though there's a structure and there are processes that have to be followed and there are rules, people feel comfortable. People can wake up and look forward to coming to work, right? You know, in those of us who are practitioners in mental health, who actually sit and see patients, other than interpersonal conflict from, you know, family issues, relationship issues, and so on, the next most common type of stress people have to deal with that causes them to come into our offices is work-related, right? Unrealistic goals, unrealistic deadlines. You know, there's a thing where we say the only reward for good work is more work.
Yes.
So we punish the people who do the best. And then the ones who find creative ways to hide in the background, look busy, and produce absolutely nothing, get rewarded.
Yeah.
And we further stress out the ones who are working hard. So we have to look at those things. We have to look at our human resource practices and make sure that they're really worker-friendly.
Should we be having mental health policies in the workplace?
Yes, absolutely. Because that protects the organization and it also protects the worker, okay? It protects the organization against lawsuits and so on when there are adverse outcomes that people attribute to things that happen in the workplace.
Right.
So there's a benefit there. But it also protects the worker Because if it is a standard policy in your work organization that, if you're not coping, you have an EAP that you can access, an employee assistance program that you can access without stigma, mind you, and without judgment. And the process for accessing it is seamless in a way that does not make you feel less than the other worker. Nobody judges you if you have to go to the company doctor because you're having chest pain because your heart is not functioning well. But we judge people when they have to go to the mental health center, whether it's the EAP or the psychiatric outpatient clinic in your community. People judge one another and stigmatize one another for that. And those are issues we have to address, and we can only address it through building awareness, through education, through keeping the conversation going so that the conversation is normalized.
But Doc, I mean, mental health is something we've been talking about for a little while now. So do we still have that stigma as bad as it was?
Unfortunately, yes, it still exists. It's being addressed. So in some quarters, it's not as bad as it used to be. But on a global scale, stigma is still a real problem.
And, they say that the school is a microcosm of our society. And recently in the news, we saw a situation where a young man took his own life as a result of being bullied, allegedly. And, that bullying is something that we also see happen in the workplace as well, sometimes from time to time. How do you suggest that parents interject and deal with that situation from the school level? And how do we interject and deal with that situation even at the adult level?
Okay, there are a couple of things we need to look at there. And my condolences to that family. I cannot imagine their pain at this time. So I really want to express my condolences to them and to the the students who, go to school, went to school every day with this child, the teachers who taught this child, his entire community, his little world, right? My condolences to them. Suicide is a difficult topic, and it's a painful topic, but it's a topic we have to address, right? It's not World Suicide Prevention Day today, that was last month, but it's important.
It's very important.
Suicide is, you can't talk about mental health without talking about suicide. And at the risk of sounding controversial, one of the things that we need to pull back from doing when there's a suicide is rush into judgment on the reason why the person may have chosen to end their life, right? People observe things, people experience things, people will have their opinions. Some may be correct, some may be not. But sometimes we need to pull back from that a little bit and let the persons in that environment deal with the issues pertinent to that environment. If there are things to be corrected, let them get corrected. But let us avoid the over-sensationalization of what we perceive to be the reason why that person did whatever happened. Because we don't know all the other factors that may or may not, because I don't know the young man.
Of course.
We don't know the other factors that may or may not have been impacting that young life.
But how do we navigate any of situation that may be similar to what we've been hearing about, where somebody feels slighted or somebody feels overpowered by somebody more powerful than them or somebody seemingly more powerful than them?
Bullying is a serious issue, and schools have to have policies that deal with it. I'm not in the education sector, so that a little bit, the how does the school address it is a little bit outside of my expertise. I'm not an educator, but I know that schools have to have policies that deal with it, and they have to adhere to those policies, and I cannot speak to what was or what's not
No,
done.
of course, I'm not asking you to. What I'm asking is, if somebody were to come into you as a patient and say that they feel like they're being bullied at work, how would you suggest that they deal with that situation?
Right, so if you're being bullied at work, there has to be a reporting structure in the workplace that allows you to report that, and there has to be a policy in the workplace that would allow it to be addressed. Now, workplaces are funny places. They're very different. No two workplaces are identical. There are places where the financial motivation rules everything. There are places where there's a more humane approach, so that it's a difficult issue, right? Sometimes people have to seek redress through their unions and be represented in that way because individually they may not feel they have the power to address people they perceive to be more powerful than they are. Right? Sometimes just talking to your supervisor may be enough because that person may have the resources to deal with it. Sometimes going to the human resource department, so it varies from organization to organization. There are times when people have to take extreme measures, like through a union or through the legal process, if things are not being addressed.
Yeah.
But the ideal scenario is for it to be addressed long before it gets to that.
To that situation, before it gets that bad.
Yes.
I understand that we have an event happening in Tobago to help to commemorate World Mental Health Day.
Yes.
Tell me a little bit about that event.
Paint the Town Green is an initiative that was the brainchild of Hazel Othello, whom I think the press knows very well. So Caroline brought that idea to the mental health unit many years ago and shared it with the team. And we've been executing it in the different RHAs every year since then. So we did it in Port of Spain first, then San Fernando. We did it in Rio Claro for Eastern RHA. We did it in Chaguanas for the North Central RHA, and the only RHA that hadn't done. Well, of course, during the pandemic, we couldn't do Paint the Town Green.
Right.
So now that we're not dealing with the challenges of the pandemic and we're moving forward with things again, we felt that it was Tobago's turn, so to speak.
Tell me what it involves.
Paint the Town Green is an experience where, because green is the color that is associated with mental health, we use that color to highlight issues around mental health and to bring awareness to mental health. So it's sort of like a health fair where the focus is on mental health, and all the logos and decorations and so on is green. And the goal eventually is not just to do it in one little RHA or one region at a time, but to make this over time a national celebration, where on World Mental Health Day, everything around the country would be green, but in much the same way as St. Patrick's Day.
I hear you. So then when we come to, is in Lowlands, Tobago?
Yeah.
And when we come to Lowlands, what can we expect? I mean, you said topics about mental health, but can you be a bit more specific about some of the services that'll be available?
The TRHAs are organizing it, so I don't know all the details, but I know they're having different activities, relaxation things to help the persons who are attending to feel relaxed. They're providing information to attendees on various aspects of their mental health. They're having physical health checks as well because, as we say, mental and physical health are integrated. So the booth's going to cover a variety of different themes around mental health or loosely connected to mental health.
Okay, because everything is kind of intertwined, right?
Yes, yes.
All right, so Doc, I want to thank you so much for joining us this morning. But before you leave, can you leave Trinidad and Tobago with a message, especially those people who may be struggling with their mental health?
Struggling with mental health is an experience that is not something to be ashamed of or afraid of or to allow yourself to feel badly about, because we all struggle sometimes. There's nobody who could say they woke up happy every single day of their lives.
Amen to that.
And felt like getting out of bed and facing the day every single day of their lives. So the most important thing is that we take care of ourselves. When you need to take some time off, just do it. Right? If you need to take a day off and do something relaxing, go to the beach or go to the park, read a book, do what makes you feel happy so that at the end of that day you feel better about yourself. Go get a manicure, a pedicure, a facial, a massage, do something that you enjoy and feel better about yourself at the end of the day. Invest in yourself, right? Invest in the things that help you to be a healthier person. Physical exercise is critically important. Eating healthy is critically important. All those basic things that we kind of push aside because we're too busy working. Workplace mental health includes healthy eating. It includes finding time for exercise. Kudos to the organizations that have gyms that are part of the organizational structure, or other ways to encourage people to get their exercise. But basically take care of your entire person, body, soul, and spirit.
Indeed. Thank you so much, Dr. Othello, for joining us this morning.
You're
and for
more than
sharing with us.
welcome.
All right, guys, we get ready to paint the town green this coming Thursday. We head to Tobago, and you can get more information. Just head across to the Ministry of Health's social media pages, and you'll get all the information that you need. We take a quick break, and we come back with more inside the Now Morning Show. Stick around.